So today's topic, surgical services, surgical care services. The purpose is to ensure that the care of the patients undergoing surgical procedures is harmless. Scope applies to OT, pre-OT, post-OT, recovery and wards. The responsibility lies on surgeons, OT in charge, medical officers, nurses, infection control nurse, everyone involved in patient care, including the infection control part. The surgeries are performed in the hospital. Surgeries are performed in the hospital as by qualified personnel. What is minimum qualification? As per MCI guideline, the surgeon should be a postgraduate in surgical specialty. Anesthetist should be postgraduate in anesthesia, and medical officer MBBS, nursing staff GNM, OT technician, diploma in OT technician or ATA. Surgeons are privileged by privileging committee following MCI guideline, and the same is documented in employee personal file. The patients undergoing surgical procedures, either routine or emergency, are assessed prior to the surgery. Once the patient's need for surgical intervention is identified, the patient undergoes the pre-operative assessment by the concerned surgeon, which includes chief complaints, relevant significant history and of the disease, examination and relevant investigation report, etc. Patient's pre-operative checkup findings are documented in patient medical record. Then after that, surgery plan is documented with all the necessary details as defined in surgical record as mentioned below. Provisional diagnosis, surgery name, surgery schedule, that is date and time, estimated duration of the surgery, surgery status, anesthesiologist. The informed consent is for the surgery is very important document. Consent is obtained from the patient's relative for the surgery by the operating surgeon in the standardized format. After explaining the following details: the surgery type, reason for the procedure, expected outcome, risk involved. The content is obtained from the patients or the surrogates prior to the surgery. If the procedure changed intraoperatively, then a fresh consent is taken from the patient's surrogate. Surrogate means next of kin or attendant. Or relative. Prevention of the wrong procedure, wrong side, we have to take some steps. One of those is WHO checklist for the safe surgery. The surgery safety checklist includes the point of the procedure, side, patient before taking the patient in OT table, that is a sign-in. Patient identification is identify the ID band verbally confirmed through the patients and their relative. Confirmation of the right side and right side applicable, or surgical site verify right side and right side. Confirmation of the right procedures, that the procedure is confirmed through the patient records, confirmed through the patient again, and through the patients their relatives. Surgery safety checklist also includes the essential imaging films are displayed during the sign-in process. The procedure site verified before the skin incision when the patient is on OT table. The procedure notes are written by the operating surgeon. If it is documented by the person other than the chief operating surgeon, the patient is same is countersigned by the chief surgeon. The operating notes are documented before the transferring out for the recovery. The procedure notes and OT notes includes the following information as mentioned. The procedure, that is the surgery, name of the surgery, post-operative diagnosis, operating team members, surgeon's name, anesthetist's name, OT technician's name, OT nurse's name, etc. Salient steps, step by step, performance of the procedure, intraoperative findings, whenever there is important intraoperative findings which is deviated from the normal or exaggerated from the normal, status of the patient before shifting. The post-operative care is given to the patient through post-operative care plan are written by the surgical report immediately after the surgery with collaboration of the anesthesiologist and operating surgeon. It includes IV fluids, medication orders, care of the ward, nursing care, vitals, intake outputs, and other observations for further implications and complications. Patient and personnel and material flows adhere infection control practices with a view to contain the infection and cross-infection with the complex OT procedure is divided into the various zones depending on the level of sterility required. Accessibility criteria in different zones are also defined. Protected zone is this is controlled atmosphere of the OT complex which interferes with the outsides. It acts as a barrier and all stuff changes the shoes and street clothes in this zone. This zone consists of the following areas: the transfer base of the patients, material and equipment, rooms for the administrative stuff, separate change room for the male and female staff, PPE area. Clean zone is just inside the protected zone. It's a fully controlled in terms of the comfort factors and particulate counts. This zone connects internally with the areas of the protected zone and operating zone. Suits. In addition, it has the following areas: that operating theater equipment stores, monitoring equipments for the special surgeries. The sterile zone is the main OT room. It is a regulated atmosphere OT complex which provides the predetermined comfort factors, particulates counts. This zone is where the operating rooms are located. Only the patient and surgery teams are allowed to access this area. The disposable zone is used for the movement of the oil soiled material is disposed of, and it should be outside the corridor. Unsterile material is lifted in a covered trolley, transported to the CSSD, and biomedical waste is also transported to the biomedical waste storeroom in covered trolley. General traffic is not allowed in protected area zone. Visitors and other personnel should change their street clothes and shoes in the protected zone. All personnel entering into the sterile zone must wear OT gown, mask, and OT caps. No personnel can enter from the protected zone to directly to sterile zone. The operating room has ventilation and the air conditioning system to provide a standard air quality and comfort. Outside the design, the head loads factors and occupancy population is taken in the consideration. Laminar flow and HEPA filters are in place. Separate air handling units have been provided. The detailed standard of the indent care and comfort are taken care of like this. Temperature between 21 and 3 degree in general OT and 18 degree plus minus 2 for the super specialty. Humidity 30 to 60%. Positive pressure is 2.5 Pascal. That is 0.01 inches of the water. Pressure is monitored and documented on daily basis. Integrity of the filters. DOP test is repeated after every 6 months to avail the integrity of the filters. Preventive maintenance cleaning of the pre-filters and microwave is done by every 15 days. The air changes per minimum cleaning of the pre-filter microwave. Air changes minimum 20, out of which 4 fresh air. Air velocity is 25 to 35 fpm. And preventive maintenance of the pre-filter and microwave is done every 30 days. So these are the main salient points of the care of the patients in surgical services. We have to take care of the patients, along with we have to make documentation. Documentation for this segment includes the pre anesthetic checkup, that is PAC, and then we have pre-operative assessment, that is the initial assessment of the patient. Then we have anesthesia surgeon's notes. Then we have anesthesia monitoring. Then we have post-operative monitoring. Post-operative monitoring includes the safety criteria for the shifting from recovery area. That is, we have to calculate LRATE score or modified LRATE scores to know whether patient is fit for the shifting from the recovery area. Then we have to look into the investigations and discharge cards, which are outside the OT, but in OT area, the surgical quality indicator parameter and infection related parameter, that is the surgical safety, that is SSI, surgical site infection. So these are the documents we have to look into, and we have to maintain all the documentation of the surgical care patients. As mentioned, this topic is very small. It is the one policy, such a standard, and that standard applies to the surgical services in the hospital. Surgical services range from the ward to the OT area, and everything, everywhere, wherever the surgical patient goes after admission is considered, and all the policies are applicable. So right now we will go to the questions and answers we have already attended as a pre-test.
सर एक चीज पूछनी थी, ये ओटी में टेम्परेचर और ह्यूमिडिटी का कोई वो है मार्क कि यहाँ तक ही होना चाहिए, इससे कम या ज्यादा होगा क्या?
अभी हमने लास्ट स्लाइड थी, सेकंड लास्ट थी या लास्ट स्लाइड, उसमें हमने डिस्कस किया था कि जो जनरल ओटी है उसमें 21 डिग्री सेंटीग्रेड +-3, और जो सुपर स्पेशलिटी ओटी है उसमें जैसे न्यूरो और सुपर स्पेशलिटी होते हैं उसके अंदर 18 +-2. सो दैट इज
ये
टेम्परेचर हो गया, और ह्यूमिडिटी है 30 to 60 के बीच में कंफर्टेबल रहता है. जो ऑक्यूपेंट होते हैं उनके लिए भी ठीक होता है, पेशेंट्स के लिए भी ठीक होता है. तो 30 to 60 के बीच में ह्यूमिडिटी होनी चाहिए.
ये दोनों ओटी के लिए सर 30 to 60?
मैंने तो देखिए ओटी को किस काम में ले रहे हैं उस पर डिपेंड करता है. मैंने अलग अलग दोनों बताया, सुपर स्पेशलिटी ओटी एंड जनरल ओटी. जनरल सर्जरी हो रही है तो वो 21 +-3, और सुपर स्पेशलिटी जैसे कि ट्रांसप्लांट हो रहा है या न्यूरो सर्जरीज हो रही है तो उसके लिए 18 +-2, या फिर सर्जरी के हिसाब से जैसे कि कार्डियक होता है तो उसके हिसाब से अलग से कुछ भी जो टेम्परेचर रिक्वायरमेंट अगर सर्जन्स को होती है तो वो मीट करना होता है. ठीक है,
ठीक है सर.
ओके, थैंक यू. Now we will go to the questions and answers, surgical safety. The questions which we have put, the surgical care services policies are applicable for following area except wards, operating theater, recovery wards, and none. So answer for this is none, because this is the negative question. You have to look at the sentence except. All are responsible for surgical care. Infection control nurse, surgeon, anesthesiologist, all are responsible. So question was incomplete. Visible, now it is visible except. So except none. This is answer for this is also none. The question number 3, surgery plan must include all except. That also surgery schedule, date and time, estimate duration of the surgery, anesthesiologist, and none. So answer for this is also none. All are policies of the safe surgery to prevent a wrong surgery, wrong patient, except. That is also none. Time out, sign in, sign out. Everything is side marking. All are steps to take taken to avoid wrong surgery, wrong patient, wrong side, wrong side. Which of the following operation theatre zone is most infectious? The answer is disposable zone. That is where the waste, infective waste, is disposed. So answer for this is disposal zone. The OT should be properly zoned accordingly. Okay, so today's topic complete. Some people did not join on time, so I did not stop in between and include them. They have to join in time. Time is already fixed, so you cannot wait until the waiting for 5 minutes, 10 minutes, 20 minutes, and then starting a 15-minute class. 15-minute class should start at right time and finish at right time, so that no one has to wait.
Right.
Those who join late are insulting those who come on time. So I will not tolerate that kind of insulting in future. Maximum grace period is 5 minutes for any meeting or training. If somebody is not able to join within 5 minutes of specified time, then we will start and we will not allow, or we will not stop to take them in. They will wait in lobby.
Right.
ओके, थैंक यू। और आज के जो
Thanks.
पोस्ट टेस्ट है मैं लिंक भेज रहा हूँ आपको ग्रुप में, वहाँ से अटेंड कर लें।
Okay, sir.